My fellow Guyanese, His Excellency David Arthur Granger, President of the Cooperative Republic of Guyana, addressed you a week ago when Guyana confirmed its first imported case of coronavirus, COVID-19, here in Georgetown. I now wish to update you further on our COVID-19 situation. Much has happened since His Excellency's declaration, and so it is timely to inform you of the measures that have been implemented and share with you the government's plan in moving forward. I will be updating you from three perspectives: medical, psychological, and economic. Regarding the medical issue, we have since, as of today, confirmed 4 additional cases, all family members of the index case, bringing our statistics to 5 confirmed cases, inclusive of 1 death. We are in the process of contact tracing and quarantining the close contacts. Thankfully, our health personnel are working assiduously to contain the spread of COVID-19 and to keep the numbers down. At the same time, around us, in the region of the Americas and the Caribbean, the number of cases is rising rapidly. The United States of America has confirmed cases in almost every state and has declared a national emergency. In the Caribbean, the number of cases in Jamaica has increased, with Barbados and Aruba reporting their first 2 confirmed cases, among others. What does this mean? In simple terms, that this global pandemic is rife, and we must double up our efforts, not only to protect ourselves, but to lessen its spread and contain community transmission. Here in Guyana, even before we had our first imported confirmed case, we responded to the news of the COVID-19 outbreak with the utmost seriousness and began the preparatory work, which included training of our health personnel, as well as staff at all points of entry. We began to accumulate medical supplies and equipment, and with assistance from our partner, had a PAHO virologist train the staff at the National Public Health Reference Laboratory to conduct the approved COVID-19 test. My fellow Guyanese, with the advent of Guyana's first COVID-19 confirmed case, the Ministry of Public Health rapidly moved from the preparatory plan to implement the action plan. Some of the steps taken were the activation of the Health Emergency Operations Center, which is fully operational in Georgetown and includes preparedness and readiness of our regional health facilities. What else must we do? We will have to tighten up further temporarily, though we cannot completely shut ourselves off. Firstly, we must get used to practicing the baseline things, namely, good personal and respiratory hygiene, adjusting to new social behaviors, which discourage large gatherings, and generally maintaining some physical distance from one another. That is why we have advised agencies to encourage their staff to adhere to the guidelines which the Ministry of Public Health and PAHO have been circulating. Further, the Ministry of Education's intervention has seen the closure of schools for 14 days, and the Public Service Ministry has implemented a shift system for public servants. The Guyana Civil Aviation Authority, at midnight on Wednesday, March 18, 2020, will close both of Guyana's airports to international flights for the next 14 days. An assessment of this situation will be done as the fight against COVID-19 continues, and you will be apprised. These extra precautions will help to slow down the transmission of the virus, help us keep our numbers down, and prevent our healthcare system from being overwhelmed. And we can do more in other areas. We can ensure that accurate information is disseminated to all. And here, I want to appeal to the media to avoid issuing any form of fake news. It is imperative to check first the reliable sources, such as the WHO, PAHO, or the Ministry of Public Health websites, before reporting to the general public. Further, I am asking all our users of social media not to share information without verifying the source. You are creating the scenarios of fear and panic to your own fellow Guyanese brothers and sisters. And let me emphasize this. The situation in Guyana presently remains under control, but we can ill afford to become complacent and in some cases even nonchalant and laid back. The threat is real. It is not discriminatory, and so we must all shoulder our responsibility resolutely and be resilient in our adherence to the precautionary measures that have been established. Even as we implement these next steps, we cannot overlook the impact that this will have on our economy. The Ministerial Task Force, cognizant of this, is seeking to address these issues. The situation will directly impact to the following sectors: hotels, aviation, hospitality, and tourism. Your clientele will be less visible, and your return will be affected. But we all must understand that this situation will not last forever, but that the brakes have been applied expressly to contain the COVID-19 situation at hand. Fellow Guyanese, I am sharing all these plans with you to keep you au fait with what the government and the Ministry of Public Health are doing to safeguard you and your family. We wish to reassure you that we are constantly monitoring the situation to ensure that no one is left behind. So, what is also critical, we have recognized, is our psychological response to COVID-19. Our frontline staff are working extremely hard to keep Guyana going. Healthcare workers, immigration officers, civil servants, public transport workers, taxi drivers, cleaning staff, and others. We applaud their indefatigable efforts. But anxiety, fear, and panic are natural reactions in a human being. And so the mental health unit of the Ministry of Public Health has come on board to provide psychosocial support, not only for the family of the index case, but also for those who may need this type of support: our health workers, response team members, and so on. We will remain resilient in this fight once we keep up our guard and take practical precautions to protect ourselves and our families. We will win this fight and carry on with our daily lives once everyone diligently performs his civic duty and responsibility. In a crisis such as this, everyone has a part to play. My fellow Guyanese, I hope that you, along with the Ministry of Public Health and other stakeholders, will work to keep our families and communities safe and keep our beloved country, the Cooperative Republic of Guyana, secure. Can we do it? I am counting on you because I believe we can.